let's keep going through your deck here too. We talked about Miguel's knee. We talked about your father's passing too. Nicole's birth. We didn't really dive into that one yet.
Yeah, Nicole's birth actually. So that was actually more for us. That was actually our first insight to a problem or a struggling healthcare system in Canada, and that was when Nicole was born 25 years ago now. We at that time had a fishing lodge up in Smithers, and so our yearly routine would be to be in Mexico 10 months out of the year, and then we would travel up for September and October and run our fishing lodge in Smithers.
Right.
The year Nicole was born, we were doing a big renovation on the lodge though, and so we came up a little early, and because her birth date was scheduled to be not too far after the lodge was going to be wrapping up, we decided that Nicole would be born in Canada. So in Mexico, even 25 years ago, so this, 25 years ago, every doctor that needs to have a ultrasound machine, or I shouldn't say every doctor, in the private system, complete transparent, we do use a private system.
Right.
But any doctor that has the need for an ultrasound in their office just has an ultrasound machine in their office. And so in regards to Nicole's birth, my wife would go for her monthly checkup prior to leaving Mexico and get an ultrasound. And of course, they check the heartbeat and size and all those sorts of things. And we even have videos and all that type of stuff of each of those, ultrasounds and whatnot. And anyways, we left Mexico, after our first couple checkups because of this renovation that we were doing at the lodge, and we got to Smithers and continued with our monthly checkups. But in Smithers, the monthly checkup was more, just the stethoscope and, the more general, how are you feeling kind of stuff.
Yeah.
But no problems. Everything was going fine. In Mexico, they had estimated her birth to be around the middle of December.
Yeah.
And so, the lodge was ending at the end of October. We were going to have a month and a half before her birth, and everything should be hunky-dory. So we were doing our monthly checkups, and in October, the doctor said that he felt like my wife was pretty big. She was massive. Her belly was getting big, and he thought maybe it wouldn't be a bad idea just to, do an ultrasound, check the size of the baby, see how things were going. And so he scheduled an ultrasound that unfortunately was going to be over a month before we could get the ultrasound done. So that was going to be, towards the end of November, a month and a half. It basically was end of November, but we figured we were still okay just because with the birth date kind of being mid-December, towards the end of December, it should have, not be a big deal, not be a problem. So anyways, finished the fishing season. We were in Smithers at my dad's house, kind of recovering from a fishing season. And November 27th, my wife's water broke and went into labor. So we took her up to the hospital in Smithers and started the process that turned into quite a terrifying process. It was very scary. You know how they say your children being born is supposed to be the happiest day of your life. Well, it was very happy, most certainly, but it was also, in my case, one of the most terrifying experiences of my life. And I won't go into the gory details, but the short version is that basically our daughter was too big for the passage that was presented to her, and so there was some
Right.
complications there. It all turned out okay. Obviously, she's a beautiful, healthy 25-year-old girl. She's not a girl anymore. She's a lady now. But everything worked out. So I can't complain too much. But it was most certainly a scary circumstance that could have gone bad, and that most certainly could have been avoided with something as simple as an ultrasound.
Right.
And then another to give some perspective. At that time, we weren't living in Canada, so my wife is a non-resident, of course. So we had to pay for all of the services that were related to my wife having our daughter in BC. Of course, anything related to my daughter was covered by the medical system, but not my wife. So my wife's portion of that birth, which ended up being a natural birth and a couple of days in the hospital, came to about $10,000. Which was fine. We were happy to pay it, no complaints there, happy to pay it. That's the system, and we were happy to do it. But a bit of perspective, 6 years later, my son was born. He was actually born in Mexico. So because we knew my wife's birthing canal was not going to be big enough, we were very conscious of that. And, monthly measurements during the pregnancy at the monthly consults with the doctor. Scheduled C-section. So scheduled C-section, private hospital, private room, private nurse. My wife stayed for 5 days in the hospital until she felt like she was feeling good enough to go back home. The total cost of that in Mexico, this would have been in 2006 when my son was born, was $3,000 US.
Wow.
For everything, for my wife, for my son, for everything. So just to give you a bit of context there, a bit of a difference between the two systems.
Unbelievable. 30%. You paid 30% of what you would have paid in Canada. That is crazy. Yeah. Okay.
And for something that theoretically I believe would probably be more expensive, like a C-section, which we had in Mexico, I think is a bit more expensive because you're talking about an operating room and those sorts of things versus, a natural birth, which was Smithers. So, and then of course, 5 days in a private room in a private hospital versus a couple days in the.
Oh yeah. So we're not even apples to apples here. It's probably 20%. Could be down to 15 once you start adding stuff like that in. Wow.
More than likely. Yeah.
Unbelievable.